Welcome to TeleMental Health Best Practices Overview webinar. Let me first cover a disclaimer. We do cover legal information in this course, but this is not meant to be considered legal counsel. This is only for educational purposes. You're certainly advised to get your own legal counsel for your practice. And in terms of conflicts of interest, obviously we provide a lot of training on telehealth and consultation. So we see it as definitely as a value. We also have affiliate agreements with vendors that are listed on our website. The outline for today is first, we're going to cover what is the need for telemental health, the benefits, the research, drawbacks, privacy law, the legal aspects, ethical aspects, how to select technology that allows you to remain legally and ethically compliant, emergency planning or protocol, steps to setting up your telehealth environment, how to prepare the client, and most common mistakes. However, this is not intended to cover these topics in their entirety. This is just to give you awareness and help you become familiar with the competencies that are involved in these different topics. To begin, what is telehealth and telemental health? Telehealth is a very broad term. It encompasses a lot of things. So it's basically using technology in healthcare. First of all, T-E-L-E, stands for from a distance. You can think about telemarketing, television, right? Television is vision from a distance. Telemarketing, marketing from a distance. Telehealth, healthcare from a distance. So the opposite of that we call same location sessions, right? Or same location services or visits, where the provider and the client or patient are in the same room as one another. So telehealth is basically anything you would be doing in healthcare as a provider, but from a distance. So that includes providing services directly to clients, but it also includes consultations that are done remotely, care coordination, education. Like right now, I am providing you telehealth services. I'm providing you clinical education remotely. So that's it in a nutshell. Now, telemental health is much more specific. It is what you think it is. It's providing therapy, counseling remotely, where you and the client are not in the same room as one another during the services, right? And it could be provided in a lot of different ways. Now, one thing to take note of here, though, is terms are often legal terms. So sometimes terms are used in law, and the law defines the term for the reason of defining the scope of what's allowed and what's not allowed. So it's important to pay attention to what your licensing board or boards say about providing these types of or services in this way, I should say. Because another thing to recognize is that telemental health and mental health services are not two separate things, right? They're both providing mental health services. It's simply the medium of communication is different. Rather than communicating when you're both in the same room as one another at the same time, you're communicating through telecommunication media, right? Which there's a lot of different telecommunication media that we use to communicate with one another. So look up your state laws, in regards to that, and they use a lot of different terms in state laws. So you have to find out what terms they use, but we do provide assistance on that. Now, in terms of the need, the government every year does this study, and it's looking at the mental health needs in our country. So, it takes a while for them to put the data together. So we have the results from 2019. And what it says here is that adults with any mental health illness felt as though they did not receive the mental health care that they needed in that year. So 26% of them, right? Now, for those with a severe mental health illness, 47% said they didn't receive the care that they thought they needed in that year. So again, these results are fairly stable. However, these results from this year are higher than they have been in a lot of the previous years. We also have the government also looks at professional shortage areas, and they specifically look at mental health. So where in our country do we have a shortage of behavioral health professionals? Well, if you look at this map, anything other than the really light blue is a professional shortage area in our country. So almost the whole country, right? Not the whole country, but almost is a professional shortage area for behavioral health professionals. That's quite significant. Now, looking at the potential benefits, there's a lot. You're familiar with these, right? So there's definitely convenience, which is huge. What are the preferences of clients? I mean, therapy only works if it takes place, right? And so what are clients willing to do? And so the convenience is really big. And then it overcomes a lot of barriers. And there's so many barriers, finding a clinician locally, a specialist, et cetera, medical conditions, being able to travel. And it's also very effective. It's client-centered because we're able to provide services in a way that's a fit for the client, not necessarily this is how it's going to be done because this is how we do it, but what's a fit for you? Like what medium of communication is going to work best for you at that time? It also helps with continuity of care, right? People move, even temporarily, and being able to continue to follow up with their clinician is super helpful. And of course, safety, like during COVID-19 with the pandemic. Now, people not wanting to get sick, but there's always people that have immune deficiency and are at higher risk of getting sick and don't want to be going out into public areas. That's always the case for some people. It's also important to look at the potential drawbacks, right? And there's drawbacks no matter what way you meet with clients, whether in your office or virtually in some manner. So using technology, there's definitely some potential drawbacks. Like one is tech issues. We are very familiar with that, right? So the technology may not work. We're relying on the internet. We're relying on devices working. We're relying on people having access to devices and internet service and people being competent and being able to use them. But then also the client's environment. So the clinician in their office, right, they can put a lot of work in selecting the location of their office, transportation near their office, the office setup itself, how people enter the office and exit the office, et cetera, et cetera. But the client's location, you don't have nearly as much control over. And that gets into privacy. When using technology, there's always risks to privacy. You hear it on the news all the time, all the different websites being hacked, et cetera. There's always risk to privacy. So that's something to really consider when we set things up. Now, limitations, there's some obvious ones. You can't smell the client. You can't touch the client. And then you might lack some visual cues according to your setup. So there's always potential limitations and drawbacks. So what's important to notice is what are they? How do you either eliminate them or reduce them or convert them into benefits, right? Now, in terms of research, there's been quite a bit of research done on telemental health and a lot of research that can still be done. But first, let's look at meta studies. So meta studies, they examine data from a lot of different studies that have been done on telemental health, and they look for trends in that research. So there was a handful of those that were done, and what they show is that providing services virtually, right, therapy, counseling sessions virtually, is just as effective as if the clinician and client are in the same location. Now, one thing I want you to take notice of here, though, is this is kind of on the aggregate level, right? So you're doing studies of a lot of different people in different situations. I think it's really important to point out that you need to look on the individual level. So what works for one person or works great for one person is not going to work great for another person. So as clinicians, it's collaborating with the client to determine what works best for them at that specific time because it might change. But in general, yes, it is effective and it's just as effective. So we know the results people tend to stick with it, especially phone sessions, because they're so convenient. They're satisfied with it. Clinicians are also satisfied with it, but not as much as clients. And you are able to build rapport and communicate effectively. So those are some of the important things to look at. Here are some of those meta studies that you can look at. Here are also great places to go if you're looking for research on specific niches or situations in regards to telemental health. Because again, there has been a fair amount of research done, but there's a lot more that can be done in terms of looking at therapy provided to people with certain symptoms, or using different certain therapy styles or techniques and so forth. So there's always a lot to be done in that regard. I'm going to move on to the legal aspects, right? So when we look at the legal aspects, what we're really looking at here is it legal? So can you provide what you're wanting to provide, where you're wanting to provide it, to who you're wanting to provide it, when you're wanting to provide it, right? Legally, or are you going to be breaking some sort of law? Now, there's a lot of laws that we're actually regulated by, quite a few, and we do not have the time in this course to go through. That's not the intent of this course, to go through all of those laws. But again, there are quite a few that you may not normally think of in your practice, but you probably do follow. One is we have several federal laws, right? And then we have state laws, and then we have contracts and agreements that we're in. And all of these can be enforced to the full authority of the law, right? And there's a hierarchy of law, right? We have the Constitution. We have laws enacted by Congress, federal laws, and then we have state laws, and we have local laws, and we have rules and regulations, etc. So in terms of laws, you have the law that may say, hey, can you do this? Are you allowed to? Are you prohibited from doing this or calling yourself this, right? And then there's rules and regulations. So when a lot of these laws are set up, there's a regulating body, and then the regulating body creates regulations for those who the law applies to. So we're very familiar with that when it comes to licensure law, right? So licensure law applies to particular individuals, and the regulating body is the licensing board. The licensing board writes up a lot of rules and regulations. So licensure law, you have practice acts. Practice act says that you cannot practice this particular profession unless you have the authorization from the licensing board. A title act would say you can't use this professional title without authorization from the licensing board. Now, licensing in the United States, as frustrating as it is state law, right? So the 10th Amendment of the Constitution is interpreted in a way that allows states to prohibit people from providing a professional service or using a professional title, licensure law, if they see fit. Now, they don't have to have licensure law in a state. It's not required, right? The government doesn't say they have to do that, but they have chosen to. So you have to look at, are you regulated by a licensing laws? Are you, does it apply to you, right? All right. So when you get licensed, right, when you are a licensed professional in a state, you are regulated by that licensing board. Okay. Now, the justification for licensing is to protect the public. The public are the people in the boundaries of the state, in the geographical region. It's the state's job to protect those people. So that's why when we look at, the laws, the licensure laws around practicing telehealth, and you look at, well, where does telehealth take place? Primarily, you need to look at the location of the client during the time of the session. So where is the client when the session is taking place? Because the clinician would have to adhere to the licensing law in that state where that client is located during the time of the session. Now, that's not all, however. If the clinician is licensed in multiple states, right, they're still being regulated by those other licensing boards. So they would still have to at least follow those administrative requirements of all the different license that they have in different states. And remember, you were not just regulated by licensure law when we practice. So if a clinician was going to practice in a state where they're not licensed, they need to consider that. Now, there are exceptions. So there are provisions in licensure law for out of state clinicians to practice for a certain amount of time. Some states have that, and the requirements for that vary greatly. There are other exceptions, which we won't spend time getting into. So you want to, consider these things very carefully if you're going to practice in a state where you are not licensed. So if you want to make sure that you are not violating licensure law, there's really three licensing boards that you'd want to consider. You'd want to consider the licensing board of the state where the client is during the time of the session, right? The licensing board of where the clinician is during the time of the session, and the licensing board or boards of where the clinician is licensed, right? All three of those. But primarily what you're considering here is the licensing board, the applicable one for you, of the state where the client is located during the time of the session. All right, so we have a web page on our website where we track legislation throughout all 50 states around telemental health for a lot of different professions. So I encourage you to take a look at that resource. It'll be a good starting point. We can't guarantee that it's fully up to date and has every little piece of legislation that you need to be aware of, but it's certainly a good starting point in regards to that. Now, in terms of the ethical standards of providing telemental health, what we're talking about is ethical practice, best practice, standard of care. These all have different definitions, and I'm not going to get into the explanation of that. But in general, what you want to do is look at where's the source of authority of best practices. You have research, you have professional literature, you have your professional associations and licensing boards, and then your clients, what they tell you, your experience. So you at least want to thoroughly review what your licensing board says, what your professional association says in their code of ethics and practice guidelines. And to do that, we actually have a website. On our website, we have a page where we list all these out, right? Because we thoroughly investigate them in putting our trainings together. Another ethical standard, or one of the I'm going to go over some of the most important ethical standards, I guess I would say, in regards to telemental health. And one is boundaries of competence. So we're only supposed to practice within our boundaries of competence. We all know that if you're not competent in providing services in a certain way, you shouldn't do it until you become competent. But how do you know if you're competent in something? You don't know that until you're exposed to what competence is. That's the trick. So that's why you're taking this training today, to be exposed to what those basic competencies are. So you'll be able to fairly assess whether or not you need further training to become competent in this area before providing services in this way, right? So that's the main thing there. Now, digital marketing, using technology. Just because you use websites and provider listing sites and social media and email and all this kind of stuff on a regular basis every day doesn't necessarily mean that you really are competent to use that for healthcare. There's several things to consider when developing your website to be legally and ethically compliant. Same with being listed on provider sites and being part of say these listservs of other clinicians. We get into testimonials, your online presence, right? Because clients look you up before they come see you. So managing your online presence is really important. The other thing is social media. It's such a huge part of people's lives today. So a lot of organizations, practices utilize social media. But social media was designed for profit by selling people's data, Sounds like the opposite of behavioral health services, right? So in using social media, it's really trying to use something that was designed for the opposite purpose. Okay. So a lot of thought has to go into that. And having a social media policy, informing your clients, adhering to it, critically thinking about how it is that you configure and use, and whether or not you use social media and how you respond to social media is really important, especially as a behavioral health professional. It could be super helpful and it could be really dangerous. So it's important to consider that. The other thing is screening for fit, right? Why should we screen for fit? I ask that because it's not like, um, it's not super easy to find ethical standards and codes of ethics on screening for fit. But codes of ethics do talk about only practicing within your boundaries of competence. How do you do that if you don't screen for fit before you take on a client? Or not doing harm. How do you do that if you don't screen for fit before you take on a client? So you want to have a screening for fit policy, right, for telemental health services. And there's several steps to that, like your treatment boundaries, what it is that they're looking to get out of the treatment, their access and comfort level with technology, their location, emergency management planning, and so forth. Also, informed consent, right? So you already have an informed consent, I'm sure, informed consent to treatment. But there certainly are things that you'd want to add in regards to providing telemental health services, such as expectations of the client. How should they attend sessions? Backup plans for technology failures. All of these kinds of things, right? How to contact you. So you want the informed consent. The informed consent really ought to provide adequate information for the prospective client to decide whether or not to sign up for services with you, and then to have adequate information so that they can effectively receive services from you and know how to follow up. So there should be, changes to the informed consent. Now, your licensing board might say specific things about what's required in your informed consent, how often you have to provide it, whether or not it has to be a separate consent for telehealth. So it's important to look at your licensing board. A lot of guidance will be given there. The other thing is, we're only supposed to communicate through secure means. Well, what does that mean, secure means? We have to understand technology and what that means. Today, security with technology often relates to encryption in where patient information is and where it resides. So there really needs to be like a thorough analysis of that and understanding of it. Verifying the client's identity. I know a lot of clinicians don't verify their client's identity. They don't really see the purpose of it or the need for it. But there are a lot of reasons why we should, such as insurance billing and age of consent and guardianship and duty to warn and duty to protect and having possible dual relationships. The law requires it, et cetera, et cetera, et cetera. A lot of reasons. So knowing how to do that through telehealth is really important, and making sure that we do it. Now, going along with that is verifying the client's location every session, because you need to know that for emergency management planning, and you need to know that to make sure that you're not violating a law in that region, right? You want to make sure they have a private location. With the emergency management plan, right? So when they come to your office, hopefully you have an emergency management plan as to what to do if they have a medical emergency or psychiatric emergency or something like that, or environmental emergency. So we ought to have those plans also with telehealth for each client in each location. And there's a process for that. We also know this very well, that our visits with clients ought to be private, right? So we have to ensure that privacy, both on the client's end and clinician's end. So these are just some of the, ethical standards to consider when receiving telemental health, some of the most important. I'm going to move on to privacy law. Now, there are, again, quite a few privacy laws to consider. And the importance with privacy law is to keep our clients' information private. Behavioral health clients rely on us for this, right? They have struggles going on in their life that are very sensitive, very private, and they trust us to hold that really private information. And we tell them, right? We say, hey, everything's confidential here. It's a safe place for you to share what you want to work on. Can we back that up when using technology, right? We don't want to do any harm to the client. So some of the laws to consider here are HIPAA law, right? HIPAA is in the United States, it's privacy and security law around healthcare information. And that's has the biggest impact on healthcare providers here in the US. 42 CFR Part 2 has to do with substance abuse providers in treatment, so addiction treatment, right? Um, Now, HIPAA is actually 45 CFR, it came later, before 42 CFR Part 2. And all of these laws have things to say about when you can disclose information about a client without authorization, when you need authorization, what are the client's rights to their records, et cetera, et cetera. There's quite a bit to it. And what the consent forms have to look like and how do you secure all this documentation. So it's good to have a good understanding of these things. Then you have state licensure law that talks about privacy. There's your professional code of ethics, and some licensing boards require that you adhere to a particular code of ethics. FERPA has to do with education organizations, right? So if you're a school, you very likely have to follow HIPAA law in regards to protecting students' privacy. Now, this also may relate to a behavioral health professional. If a mental health provider is partnering with a school, then the school is going to have to adhere to both FERPA and HIPAA, right? And then there's organizational rules around keeping clients' privacy private. Now, whether you provide telehealth or not, these laws will still apply to you. You'll still have to comply with them. And including telehealth into the services that you're delivering doesn't have that much of an impact, but it does have an impact, right? And there's things to be aware of about that. So it's important to investigate those things. Now, in regards to HIPAA law, again, that's going to have the greatest impact on you as a healthcare provider around legally protecting the privacy of your client's information. HIPAA law is regulated by the Department of Health and Human Services. It's enforced by the Office of Civil Rights. And HHS, the Department of Health and Human Services, they provide guidance for us behavioral health professionals. We're kind of special in that way. They realize that we're super cautious about revealing, disclosing patient information. So how do we make decisions as to when to disclose to family members or friends or other providers without authorization from the client? So they have decision trees for all these things for kids and adults, etc. So again, I highly recommend that you look at their documentation on that and take further training on it if you aren't familiar with it. So in HIPAA law, there's 4 main rules. There's the privacy rule, security rule, breach notification rule, and enforcement rule. One of the key things you have to consider with providing telehealth services in HIPAA law is the requirement that if you are a covered entity under HIPAA law, right? If HIPAA law applies to you, you have to receive a HIPAA business associate agreement from all of your business associates. Now, who is in a business associate? Business associate is another entity that you have do things for you for your healthcare services. So like if you have a technology vendor that you use for video conferencing, chat, email, EHR system, anything like that. If you use a biller, an attorney, or someone like that, where they have access to your client's information to help you run your business, right? Your healthcare business. They are a business associate. Now there are exceptions to that, which we get into in a fuller training. But that's one of the key things. And just getting the business associate agreement is not totally sufficient. you still have to, with reasonable effort, make sure that that entity is actually complying with HIPAA law. Um, yeah, so this is all about protecting your client's privacy, right? That's the goal here. All right, so in terms of selecting technology to use, this is key. I mean, you really want everyone to have a great experience, for it to be safe and secure, reliable, and sustainable, right? So I know with COVID-19, when that hit, everyone just a lot of people just scrambled to get technology, but it's really good to be thoughtful about this. Some of the technology you might need for your practice is like somewhere to store your records, or to collaborate with other electronic health record systems, or have a practice management program online where you can manage your practice. A way to transfer documentation or send messages to other people, or collect payment, or video conferencing, phone, voicemail, fax, email, devices, your peripherals, which are like your camera, your microphone, your speakers, or like a stethoscope or an EKG, or otoscope, if you're working with other healthcare providers, remote monitoring devices, mobile apps, and telehealth carts, right? Which you may not be using. But these are a lot of different types of technology that you might need to consider bringing on, and being thoughtful about that in the beginning is going to really help a lot, right? So the first thing that you want to look at is a needs analysis. What do you need as an organization? What do you want? It's going to go according to your workflow as an organization for your telehealth services. What are your preferences, your budget, and what current technology do you have? Because you want that new technology to integrate well, right? So we go in depth in these things, in other courses. But after you complete your needs analysis, then you're going to look at getting information from the technology vendors, right? There's a lot of information that you're going to want from them. You're going to want that HIPAA business associate agreement, and how is it that they truly secure information? How do they take requests for fixing things or new features? How do they, how do they respond to tickets? And then you want to consult with people who've been there, done that, and are familiar with these things and know what to look for. I'd highly recommend that. And then you want to conduct your risk analysis of using that technology, test it out very well before you implement it, right? So these are the basic steps to this. And after you select a technology vendor, then you want to really consider that vendor service level agreement, right? That's your contract with that vendor. And it depends upon the size of your organization, the scope, et cetera, in terms of how much you want to look into this, right? But it's definitely worth it to find out, what type of service do they provide you? What's their history? What are the different, they want to define what's included, what's not included, et cetera. Now, after you select the technology, get the technology, you're going to conduct a risk analysis of using that technology, create a risk management plan to mitigate those risks, because no matter what technology you select, there are definitely risks to using it. We do a lot of this. We always identify risks. So you want to mitigate those risks, then clearly identify what's the use case for that, for the technology, create a workflow, user guides for the clinician and client, and the policies and procedures for using that technology in healthcare. Now, most of these things, like all of these down here, are really easy to do once you finish that risk analysis. The risk analysis is the most difficult. The others just kind of flow from that. And then tech support, right? So how are you going to provide tech support to your clients and to the providers? Who's going to do that? And if it's an outsider, do you have a HIPAA business associate agreement with them? Now, with emergency management planning, again, every session, every client, you need to know how it is that you're going to be prepared for an emergency, respond to it, and follow up with it remotely. Now, some clinicians get a little worried about this. But planning will set you at ease. The greatest fear, some people say, is the fear of the unknown, right? So going through the process of creating one will definitely set you at ease and mitigate the risk of you making mistakes or making choices that you wish you wouldn't have made, um, by doing that, right? So, and again, some other courses we go more in depth into how to create this plan, uh, and you're going to have a plan for two different situations potentially in your organization. One is for unsupervised sites. That's where a client is at a location by themselves, really. There's no support person available uh, to help them in the case of an emergency. They're at home in a car in a parking lot, in their driveway or something like that, right? In their office at work. A supervised site would be where you're contracting with another organization to provide telemental health services like a school, nursing home, community health program, etc. And you want to understand what their emergency management plan is, make sure it is reasonable and that it works, etc. So there's going to be, two different situations here. And the clinicians providing the service, right, which is called the teleconsultant, they want to be prepared for these emergencies for every session. And part of that is having documentation, right? You want to know information going into the session, like who is the client, where is the client during the time of the session, what if there's a technology failure, how do I get in touch with that client, those kind of things, right? So we want to implement all the same standards of care for telehealth as we would if we were in the same room as the client during the sessions taking place. Now, in terms of the skills of providing video sessions, I know that most people have used cameras, taken selfies, being on video with friends and family and whatever else, right? So they're like, hey, I know how to get on a video call. It's not rocket science, Ray. I click on a button, I'm in a video call, wham, right? There we are. But it's not so easy. Let me tell you, I've been doing this for, I don't know, 14 years, 15 years or something. And I am still learning every day about video setup and having good audio and video and lighting and being able to be flexible with the environment given different situations and all of that. Um, so, a lot of people show up where you only see their forehead or they're all darkened out or the audio quality is just horrible, right? So you've been on these kind of meetings with people and it happens. And just having good etiquette, you don't want a client to have a poor experience, right, with the video session. So really preparing for it, just like we did in graduate school and our supervisory training, where we would get feedback about our environment and how we place ourselves and our body language and all that kind of stuff when we're in the same room as a client. Just learning some basics of how to do that appropriately when working with video. And part of that is knowing your technology, right? So video conferencing technology is called a video client. It's important to really know and understand your video client, the configurations, how to use the different functionality, how to provide tech support. Where do you get support yourself for using that video client? Does it work on all browsers and devices? And how do you help people who are using different browsers and devices? What kind of bandwidth is required? What are some backup plans? Those kind of things are important. All right. So, in terms of setting up your environment, there's quite a bit that you want to think of here. One is you definitely want your environment private, right? So some clinicians say, well, because everyone's on video now, people understand, like if they hear background noise or people are walking by in my background or whatever, right? People just understand. Not so, not so, not when we're healthcare providers, right? Especially behavioral healthcare providers. If you can hear someone in my background as my client, you would only assume that people in my environment can hear you. You ought to think that, right? That would totally make sense. Um, so the environment needs to be set up just like you would if a client was coming to your office, right? Pretty much in terms of privacy and security and them being able to see your whole office, right? So if you think like, well, clients don't need to see my own office because they just need to see right here. No, like, is that fair? Like, if I was your client, I said, can I see your office just to make sure that it really is private? And you're like, oh no, I'm going to be thinking, what's wrong here? Like, what's going on? Right? So we ought to have really good professional standards, right? So we got that privacy and security, background noise, interruptions, listening devices, all the protect the environment so we don't have people just walking into the room, stuff like that, right? Um, Having really good lighting, good audio, good camera, good gaze angle, all of these things are really important for engagement, for the experience of the client, etc. And like lighting is very difficult. Like in my office, I use the window for light a lot, but that changes throughout the day and throughout the seasons, and I have to be prepared for that. The audio, I use a high quality microphone in camera, backup plans for technology failures, all those things. And then you want to be able to, help the client make adjustments and prepare their environment, right? Which we'll get more into. So that's a really important piece. And, I know a lot of clinicians are working from home. When you set up your office, you're probably really diligent to make sure that your office really is private and secure, that then even the network, the internet, all of that stuff is really going to protect your client's privacy and provide the best experience, right? So if clinicians are going to transition to a home office, really should make sure that home office has the same standards and requirements before doing that. Otherwise, stay at the brick and mortar, until that home office, even if you're not meeting with clients there, just do telehealth until the home office is really prepared appropriately for that. So, the environment now, colors and your background, and we talked about lighting and eye contact, proximity of you to the camera and your posture and your audio, the volume. You want to look at preparing and testing the equipment so you don't have problems. And in terms of leaving and arriving, like usually you want to be waiting for the client on the call and you want to let them leave first. And people use different devices and props and so forth to encourage client engagement. There's a lot that you can do with that. There's things that you have to be careful about doing, right? So there's the direct to consumer. DTC is direct to consumer. That's where you're providing services directly to your client when they're at their own home location. Okay. And we're going to go over the basic workflow for that. It's pretty common sense, but you want to screen for fit, have an intake call with them. You want to establish that emergency management plan. They're going to be registering possibly remotely on a website, right? And then they're going to be scheduling with you. You're going to have a pre-session with them, which might take place during that clinical intake, or it might take place at another time to make sure the client is prepared, especially for that first session. Now, if you think about it, it takes them a little time to travel to your office, right? And even when they do, you give them a little bit of information before they come to their first appointment. So same thing with this pre-session. You want, again, them to have a really good positive experience during that first meeting. Sometimes it takes a little bit of preparation. Then they're going to have to get that meeting link, where to meet you. Now, this is where a lot of clinicians don't pay attention necessarily to the security. That meeting link, ought to be secure. The meeting ought to be secure. And then there's things you want to cover during that initial session with the client, especially during video calls. There's some things you want to go over. And then the follow-up sessions. And then, of course, documentation and billing. With documentation, with telehealth sessions, there's a couple different things you want to include, like how did the session take place? Were there any tech issues? Those kind of technology-related things you would document. So we want clients again to have an awesome experience, right? And they will. When clinicians are prepared, they have an awesome experience usually. They're like, this is great. Why haven't I always been doing this? How convenient has this been, right? I need to see a clinician. Wham, I could see a clinician, the clinician that I want to see that specializes in what I'm struggling with, and it's convenient. I feel comfortable, et cetera, et cetera, et cetera. So a lot of clients are going to love it. We don't want clients to have a frustrated situation where they're not sure about the expectations or worrying about the technology. I always have these tech issues. What am I going to do? And am I going to actually be able to communicate and connect with my clinician effectively? So the way to, you know, avoid this situation and have it where the client is just having a great experience is called a client orientation or a tech check. And there's certain items that you want to go through during this time. One is just letting them know, how are they going to register? How are they going to attend the session? What are the expectations of them during the session? What are the backup plans in case there are issues, right? Or they struggle getting into the session? How will they make payment? So how does this work? Having that information ahead of time, and it doesn't take long at all, will really set them at ease and help them be prepared for these things. The other thing is giving them basics of how to protect their own privacy. So when they come to see a clinician, they just rely on the clinician to, you know, help keep their information private. But now they're going now some of the responsibilities on them, but they might not think through how to do that. We're the ones that do that risk analysis and help inform them of those basics, right? Of selecting an environment that's appropriate, making sure that they don't share their login credentials, logging off after the session, use secure internet and devices that, they don't fear might be monitored by other people, etc. Those basic things. And then going over with them what the emergency protocol is, and how you're going to verify their identity and their location, and explaining to them how to use the video conferencing software and how to get the most out of that, right? And now giving them the meeting link, right? Some clinicians email them or text them, which is likely not secure, okay, unless they're done appropriately. Or just having a meeting link on their website. So these are things to consider. One security measure that a lot of video clients use is a waiting room, where if someone does come to the meeting, which is simply a URL, right? All it is a web address to get to the meeting. They'll use a waiting room where people are not able to actually enter that meeting without the provider clicking a button to allow them in. That's a great security feature, but sometimes it has security issues depending on the platform you use. Like one thing you want to make sure is if you let someone into the meeting, then they leave the meeting, can they get back in without you letting them in again? That's something that has been an issue with some of these waiting rooms. And then you want to be able to authenticate the person before you let them in. So there are some really good safety measures like, password protecting meetings, locking meetings, etc. All right. Then there is what we call CTC sessions, or clinic to clinic sessions, where you're contracting with another organization to provide those telemental health services to them. And this is also called B2B, right? Business to business. So you want to look at the workflow for that. And you want to look at that. It's called a telehealth service agreement. And the different sites is, where you are located, you're the telehealth consultant, is called the distance site. Where the client is, the organization that's hosting the client, is called the originating site. So you have the telehealth service agreement between the two of you. And there's things that you would want included in there to protect both parties and to make things clear, so there are not mistakes that happen there. The other thing to look at is your own therapy style, techniques that you use, the theory that you go by, right? So there's a lot of different psychotherapy styles. There's integrative or holistic therapy, humanistic therapy, cognitive therapy, behavioral therapy, psychoanalysis, and etc. A lot of them, and a lot of different techniques and modalities, etc. So the question is, how do you transition from your therapy style and the techniques that you use with clients when you're both in the same room as one another to a telehealth session? How does that happen? Um, you just try it, which you could. But there's a process you can go through where you can list out all that is involved, right? The basics, the basic components of your therapy style and techniques, how it is that you employ that when a client's in the same room as you, and then looking at are there potential limitations or benefits or neutral when transitioning to the online environment? And then what modifications, if any, should you make or that would be beneficial? So taking some time to look at that can be very, very helpful. The other thing to consider here is the impact of using telecommunication technology on the therapy session. So that's one thing, but then also selecting the appropriate modality of or medium of communication for the client at the time of that session. And there is a lot we can say about that, right? So just communicating through technology has an impact on people, and it's not the same for all people. There's a term, the disinhibition effect of online communication, right? Where people might not consider the other person as much when communicating online, or they might consider them more. Depends upon the person, really. There's a difference between being able to see the person through video versus not. Difference between just having phone sessions or just using text-based. And there's benefits and drawbacks to all the different mediums of communication that we use for clients. So when we look at our therapeutic style, what are the main components of our therapeutic style and techniques? And what are the benefits? What are we trying to achieve with that? And what technology is going to best assist with that? Okay. And again, it's going to depend upon the client. So we also want to look at how it impacts the client and the clinician. So when you first look at yourself, so when you communicate with someone that's in the same room as you, how is that different than when you communicate through video with someone? How is that different for you personally when you communicate only through phone or only through text? How do you experience that differently? What's the impact on the receiver of the communication that you're having when you communicate through those different methods? What do you gravitate towards? What do you avoid, and why? It's important to understand these things when you're providing services, through telecommunication technology. And then same with the client. Now, the client might prefer a particular medium of communication. It doesn't mean that that's the medium of communication that's going to be most helpful for them at that time. Sometimes we have to stretch outside our comfort area, right? To have the change that we're looking for. Sometimes we don't really know until we test it out. Now, there is some research on this, but a lot more research could be done. So in some of our other courses, we investigate this, much more fully. Another thing I want to look at are some common mistakes that clinicians make, right? And this is not, this just simply happens, right? So some common mistakes are lack of preparation, right? how do I say, I have to provide telehealth now, so I'm going to grab a technology and start providing it, which a lot of us have been put in that position where that's how it had to happen. Um, but it doesn't take that much time. I've made this mistake myself with setting up my environment. So sometimes I would think, well, yeah, I'll set up my office that's, pretty much conducive to video conferencing, rather than just stepping back, doing some research or getting some training how to really set up the best video conferencing environment using technology, and spend a little bit of money, take a little bit of time, and get it set up appropriately in the beginning, right? It would have saved me a lot of headaches, right? So the preparation, I think, is important. And part of that is getting training, right? Taking a comprehensive training in telehealth and then practicing the skills, but not just by ourselves, but practicing with colleagues who can give us honest feedback so we can make some adjustments, right? Make those adjustments, notice those blind spots that we're not noticing ourselves, like we did in our clinical supervision years, right? That's one thing. The other is, um, in terms of the workflow, looking at the workflow of your telehealth services that you're providing, actually just write it out. What technology is going to work best for your practice and your clients? Choose that right technology in the beginning, making sure you have the HIPAA business associate agreements that you need. Looking at how are you going to get consents from your clients remotely, like e-signatures, and how are you going to verify their identity and location and have that as part of the process so it's not missed. Setting up not only your environment, but this moves into preparing the client, right? So preparing your clients appropriately rather than just saying, hey, we're going to meet at this link, right? Giving them clear instructions, giving them access to the link in a way that really is secure and appropriate, where you can be HIPAA compliant, helping them understand how tech issues can be resolved, testing the equipment, and having your client test the equipment before their first session, right? So you can work out the kinks. And some technology providers actually provide a process for that's built in, so the clients will be able to test out their equipment before even attending the session. And when selecting the technology, some clinicians either don't select technology that allows them to be HIPAA compliant, or that's not secure, or they really haven't conducted a risk analysis of using that technology and use it in ways that are not secure. So that's one thing about technology. Technology could be set up in a way that is very secure, but then you put it in the hands of the user and they might use it in ways that are not secure. So doing a little investigation in terms of how to use it appropriately and what are those risks could be really helpful. And then choosing technology that is high quality. I can't tell you how many providers we hear from that say the video conferencing system that they use, it's super glitchy because they chose technology that requires, more bandwidth than others and just doesn't have the amount of quality, that they really need. The other ones is boundaries. So sometimes, when clients come to your office, you kind of control the environment and what happens there. When clients are at their own home location, they might be driving or have other people in their environment or double tasking or all sorts of things happen, right? And sometimes clinicians are thrown off guard and they're like, oh, well, okay, right? So being really clear as to how am I going to handle all these things that could potentially come up with clients when they're in their own environment, and how do I hold to those professional boundaries in a way that's therapeutic, and also, allowing the clinician to uphold those same standards that they would if the client was in their office. So those are some of the main things that you want to look at. The other one is that sometimes clinicians, they will become a provider for another organization, or they'll get listed on a provider directory. And sometimes what happens there is the clinician will assume that the organization that they're signing up with has set things up in a way for the clinician to be legally and ethically compliant. Historically, that has not happened a lot. Okay. Historically, clinicians have really had problems with this. Some of these online companies have gotten better with it because they've gotten pushback. But it's still really important that when contracting with an organization to provide services for them, or even being listed as a provider on their website, making sure that you're still upholding all of those ethical and legal standards is very important. And sometimes there could be things, that you might not think about in regards to that. All right. So in terms of, opportunity and training, so if you're wanting to really get expertise in this area and cover all of the essential competencies of telemental health, that's what our telemental health training certificate program is all about, right? So we developed this years ago and continue to update it. So it makes sure that all of those essential competencies are covered adequately so that you will be competent in providing telemental health services. And then if you need more training in a specialty area, we have that. So we get experts from around the country in different areas of telehealth and telemental health to provide courses. So there's a lot of specialized courses in that. But that is what I would recommend to you. We also have a lot of resources on our website. We offer a lot of free webinars and resources, and we're available here for you if you ever have any question, just to reach out to our support team. So that is an overview of telemental health. We touched upon a lot of the essential, aspects of telemental health. And thank you for attending. We greatly appreciate it.